While the numbers are still on the high side, authorities say the state's COVID outbreak is showing signs of stabilising. There were 73 new cases announced today. Of those, 52 have been linked to known outbreaks, meaning 21 are mystery cases. 49 were out in the community during their infectious period. And given there are now 805 active cases and a ballooning number of exposure sites in Victoria, the prospect of lockdown lifting is feeling further away, which is why the business sector wants different benchmarks used to determine if restrictions can be eased. Nicole Asher reports.
For these hairdressers in Melbourne's west, the latest lockdown extension is yet another blow.
It has never gone back the same. With this previous lockdown that we went back thinking we're just going to pick it up. No.
All business needs to know is when is this going to lift, what are the parameters that need to be hit, and then business will tuck in behind that.
What the lockdown extension announced yesterday entails remains a mystery.
It might take about 6 weeks of hard lockdown to get us back to less than 5 per day, which is a long haul.
The government's yet to set an end date for lockdown 6, but the opposition wants targets announced.
Give us hope. A plan to get students back to class, starting with VCE students, reopen playgrounds and ban the curfew.
Today, there were indications some rules might be revised.
It's a balancing act. We want to make sure that people can sustain those behaviours. We want to make sure that mental health of adults and kids is supported to the fullest extent that we can.
As the effort to head off transmission continues, this school in Dallas in Melbourne's north was listed as a Tier 1 exposure site. And a pop-up vaccination centre's been set up for workers at an industrial area in Sunshine West, where viral fragments have been showing up in the wastewater. There's demand for something similar for high school students ahead of VCE exams.
And it's become really almost an arms race to try and get vaccines for these kids. And that's not how it should be. It should be a much more well-planned and well-thought-out system.
Why didn't we prioritise any number of really valid and important groups, particularly VCE students? It's because of supply.
But vaccinations are having an impact. More than 3/4 of the active cases in Victoria are people under the age of 40.
That is not the demographic spread of age in our community. To have fewer than a quarter of cases over 40 years of age, that is the effect of vaccination. That is telling a really positive story.
High demand for vaccinations means today it was impossible to get a first dose Pfizer appointment at a state-run clinic. With more than a third of Victorians now double dosed, there are growing calls for more freedoms. But hospital workers have issued a stark reminder of what it was like during Melbourne's second wave.
They'd come to me and they'd say, "Kylie, it's like nothing we've ever seen before. These patients are young, they're fit, and then the next minute they're well, and then the next minute we're taking them to ICU. I'm worried I'm going to have to ask them to stand up and do it again."
There are 49 Victorians in hospital and 15 in ICU. Nicole Asher, ABC News, Melbourne.
In regional Victoria, the focus for authorities is now on the Shepparton community. Another 9 cases have been recorded there, but authorities say numbers are plateauing.
There were 2 mystery cases notified yesterday. They are now linked. All cases in Greater Shepparton are now linked in this outbreak. That's a good news story.
There are now more than 940 exposure sites across the state, including in Traralgon, which recorded a positive case yesterday. Testing there continues, but officials say it's not a high-risk area with a close contact of the case testing negative. Let's take a quick look at Victoria's vaccination numbers. Just over 55% of eligible Victorians have now had 1 dose of either Pfizer or AstraZeneca. That's about 3 million people. 34%, or 1.8 million Victorians, are now fully vaccinated.